comfortable for you today, okay? And let's start our class as we normally do with a bow. So we take our right fist, that's the sun, and that flat left palm. Since we're doing health Tai Chi, martial arts Tai Chi usually covers the hand instead, but for what we're doing today, it's an open palm. So that's the sun, this is the moon, and then we bow down to one another in respect to start our Chair Tai Chi class today. Welcome. Yay, welcome, Louise. All right, so we're going to start with the breath. So find your belly button. I got to kind of dig around to find mine. There it is. And then we do 2 finger widths, the knuckle that's closest to the palm, below that, and then you hop your finger down. So that's the center of your dantian, your collection center for collecting energy and then sending it out through the various meridians in the body. That's a little bit more complicated than what we're doing today, but just know we collect energy in this little center. I'm going to take the center of my palm, place it in that center place, and then the other hand above that. So why am I doing this? So I want to notice my hand expanding forward as I breathe in. So I'm expanding my belly out as I breathe in, which is not normal breath, okay? And then I contract my belly button towards my spine. Your chest is also going to move, but the reason why we do lower belly breathing, again, is to collect energy into our dantian center and to lower our blood pressure, lessen our heart rate, and to increase cerebral spinal fluid flow, which has been shown to get the waste out of your brain. So helps with lessening dementia. So here we go. We're going to breathe in, expand the belly. Might feel weird when you first do this, okay? And then exhale, really draw it towards your spine. Let's do that again. Inhale, belly big. And exhaling. Again, here we go. Breathe in, belly big. And exhale. One more time. Here we go. Breathe in, belly big. And exhale. Beautiful. Excuse me, I just burped. Let's start with cupping the hands and swinging the arms. So we're lubricating those elbows, those wrists, those shoulders a little bit. You might notice one side is a little spicy. It might be, okay? Maybe you need to do it with less vigor. Just know that, okay? And if it's available, let's take our fingers and tap the tops of the shoulders so we kind of get a little extra elbow bend there. I kind of feel like I'm the Tin Man and I'm just kind of oiling up my joints here. Couple more times. So this loosens the muscles around those shoulder joints. And again, kind of moves that ball and socket joint in the shoulders. 2 more, 2 and 1. And then I'm going to scooch over to one side of my chair because we're going to do the arm stirs. So basically you're drawing a circle out to the side. So this is, again, kind of range of motion in that shoulder joint. This specific one was used for when I had my pacemaker put in. I had to have my arm in a sling for about a week and a half. And so that arm was like very stiff. And in order to get my range of motion back in, I did arm swings and these arm stirs. So I was really tickled to see, oh, man, that's a Tai Chi movement. And then let's pause and then go the other way. My other way doesn't ever make the same shape. I don't know why that is. Some folks will put their hand on their shoulder instead of on their leg. So, you kind of do what you need to do. This feels more comfortable for me on my pacemaker side. I normally don't put my hand on my shoulder on the other side. And then make it smaller, smaller, and smaller. Then come back to the center of your chair, bring your hands up. Now the arm that you just swung or the stirred, does it feel any different than the other one? Sometimes, you feel this little subtle or very not so subtle difference. Let's do the other side. So again, kind of let that arm dangle there and start your circle. Start your circles. I'm thinking of NASCAR right now. Okay. Yes, I'm going to say the weirdest things, okay? My son and my husband would go to NASCAR and they would bring back the photographs with them with the big old earmuffs on, and they were sunburnt and would never wear sunscreen. Anyway, this is up in the Dallas-Fort Worth area. I live in Texas, so there you go. That's where NASCAR comes. Well, they come to. Austin too, don't they? We never went to Austin. All right, and then pause, and then let's go the other way. So drop the other way, make that circle go. You're going at your own perfect pace, whatever that means for you today, okay? Always keep it between the easy and ouch. Probably don't go towards ouch. Maybe a little spice. But when you have spice in a yoga pose and a Tai Chi pose, return your attention to the breath. Listen as it goes in through the nose and out through the nose. Kind of a redirection of senses. Make it smaller, smaller, and smaller. Very good. Now bring the hands back on up. Notice if they feel the same, different. Just notice what you notice or don't notice. And that's okay.
Lay down. Come up here and lay down
Oh,
on your baby bed.
sorry. Let me mute y'all. I forgot to mute y'all.
Lay down. Go up there and lay down. Lay down on your baby bed.
Okay. Sorry about that, folks. Sometimes I forget what I'm doing here. Mute everyone. I don't see it's a new Zoom, so I don't know where to find it. Okay, well, we'll just kind of go with the flow, okay? All right, so for next, let's let me think here. Spin those hands. Yeah, when they changed the parameters around Zoom, things where I found them before were not where they are now. So it's like, oh, where is that? And then let's reverse that. Again, this is great for carpal tunnel, kind of loosen the tightness that might be had here around the wrists. Little air coming across the neck. Very good. From here, let's bring the hands together. Let's do swimming dragon. Now I'm going to bring my knees a little bit more apart. And again, I'm away from the back of the chair when I do these postures. You might feel comfortable doing that too. From here, breathe in, belly big. Exhale, push the hands away, turn the head the opposite direction. Ooh, notice if it feels stiff or not. Now stay here, breathe in. Exhale back to the center. Stay here, inhaling. Exhale, push it away. Staying here, breathe in. Exhale back to the center. Let's do one more each side. Again, breathe in, belly big. Exhale, push it away. Inhaling, stay here. Exhale back to the center. One more time, here we go. Breathe in, belly big. Exhale, push it away. Staying here, breathe in. Exhale back to the center. We're going to do what's called a finishing breath. So we inhale, circle, sweep arms up, and then hands on top of a ball. Imagine that. And you're bringing the energy from the universe back on down to the Danti end, back down to your lower Danti end. From here, let's do, let's do the one where we spread the hands and the arms out to the sides. So we bring more blood flow into the brain, more carotid openings there. So you spread out the hands, and I'm going to lower it just a little bit. And I'm going to take my thumb, turn it to the back of the room. So really activating different meridians going on here. So definitely the heart meridian. And I'm going to take the opposite ear, drop it towards my shoulder. Woo! Kind of feeling some tension going on in that shoulder, in that bicep, tricep. And then I'm going to take my chin, look towards my shoulder. Again, some little range of motion challenges in the neck, the shoulder musculature. Then you take your chin, look where the wall meets the ceiling. So, tip that chin up. Then we're going to draw a half circle or a smile with our chin. So we take the chin towards our chest and then towards that extended arm side and release. Let's do the other side. So again, spread out the hands, spread the feathers, lower the arm, and then turn the thumb to the back of the room so you get the activation of the upper arm. You might feel a little contraction energy going on there. We're going to take that opposite ear, drop it towards the shoulder. Now, some folks take the hand off the leg, and it allows them to feel it a little bit more. That's always optional, okay? And then we're going to take the chin and turn it towards the shoulder. Notice what you notice. There might be some little spiciness going on. Maybe, maybe not. Again, thumb turn to the back of the room. And then take that chin, look where the wall meets the ceiling, tip it up a little bit. And then we're going to draw that half smile, that half circle, bring the chin towards the chest, and then towards that extended arm side, and release. Clap the hands and get some heat into those palms. What you can do is rub thumb bed to thumb bed to get some nice heat started, and then move it into the palms, and then move it into the fingers, like you're trying to start a fire with a stick in between your palms there. We're going to do a little traditional Qigong detoxing today, a little tapping with these warm palms. So we're going to take the cupped hand and tap, tap, tap to the outside of the arm and bring it into the shoulder. Ooh, that's my favorite part. Bring your arm up, go to the armpit, lots of lymph nodes in the armpit. Bring it down the side body to the hip, lower the arm a little bit, up the underneath the belly button, and then tap, tap, tap up the center. I lift my chin up when I do that because of my pacemaker. And then I'm going to go back to the shoulder. I'm going to do a palm up this time and go down the inside of the arm. So here we go. Okay, and then just kind of slough off that excess kind of itchy energy is what I like to call it. We're going to do the other side, but first we're going to rub the thumb beds. Here we go. And the palms and the fingers. Woo! Now, if you've got rings on your hands, be sure to cup the hands on the side of the body so you're not hitting the ring on the bones. So here we go. Tap, tap, tap. With my bracelet. Very good. Get that shoulder. Stay here just for a little bit, or maybe a little bit longer. Bring your arm up. Get to that armpit. Again, moving lymphatic fluid with this arm pat, and bring it down the side body. I got to twist a little bit on this side. Bring it down below that hip. Bring the arm down a little bit here in the middle. And again, I do a little soft fist when I bring it up. And then go to that shoulder. Palm up. Bring it down the inside. Woo! All right. Slough off that energy. Very good. Now we're going to move on to a little bit more of tapping. So here the thymus is about 2 finger widths below the collarbone, maybe 3. And we often lose T cell production after the age of 30. So we're going to manually stimulate the thymus. Now you can do, just one hand or 2 hands. Notice if it feels tender. That could be maybe you've got some inflammation going on in your body. Now, hopefully you're not whapping. You're just tapping, okay? And I like to do this. I don't know if you all like to do this, but I imagine like I'm Tarzan, right? Add a little vocalization to it, maybe. I know that's weird. Very good. Woo! Clap the hands and rub some heat. Okay, now we're going to transfer this heat to our knees. So get it on your knees here. Very good. Ooh, that feels nice. Now you're not pressing down to where it hurts, okay? You're just transferring heat from the palms into those knees. That's good for any of that kind of arthritis type of thing. Adding a little bit of touch sometimes helps lessen chronic pain. Now reverse it. Now what I like to do is come up on the pads of the fingers and go around the kneecaps. It's almost ticklish. We're stimulating all those wonderful acupressure points, and reverse it. And one of the things for lessening knee pain is to, again, to take the palm of the hand, lightly tap, tap, tap the outside of the knee. Now I'm kind of hinged forward when I do this. I'm hinged forward, okay? So you can maybe hinge forward a little bit too. I've got a long upper body, so it makes it easier for me to get to my places in my body when I hinge shift a little bit. Now, you can do same side arms as legs on the inside, but some folks like to cross them. Be fancy and tap, tap, tap. You choose you. Again, we're getting the knees ready for our knee strengtheners next. Okay, but first we've got to pump the calf. So let's bring a leg out to the side. Just kind of wiggle, jiggle it out there. And I'm resting on the back of the heel. And I'm inviting that toe towards my heart center. Woo! My calf feels a little tight today. That's okay. So we were talking about this in one of my classes before people like rush out of the bed to go to use the restroom. If they can, to do a few calf pumps to get the lower body kind of woke up before you go and walk to the restroom. And then we're going to point the toes away. So just kind of notice if it feels different when you point the toes away as opposed to toes towards you. Some folks feel a big difference. Some folks, it's just like very minimal. And just notice what you notice or don't notice. And then let's get that calf pump going, okay? So we're turning blood flow from the lower extremities back to the heart. The calf pump is also considered a blood glucose lowering technique. Do this after you eat. If you're not able to get up and do that little walk after you eat to, keep your blood sugars, nice and aligned. That was a University of Houston study that came out about 2 years ago. Calf pumping's effective for lowering blood glucose. And let's bring that leg in. We got to do the other side, so bring it out. And again, resting on the back of the heel. If you need to bend the knee a little bit, but you're still toes towards you, okay? So again, if you need a little bit less straightened leg and maybe a little bend, that's all right. I'm going to wiggle it out a little bit. And again, toes towards you. Sit up tall if you can. Woo! Does this side feel different? Do you notice your left versus the right? Does one side feel more like tight or stiff or loosey-goosey? I don't know what the words are to describe one versus the other. Does it feel different? Does it feel the same? Who knows? All right, and point the toe away. Now, if you signed up for this class because it says Gentle Yoga for Back Care / Chair Tai Chi, I'm going to assume that maybe you have some back challenges. And then when we have back challenges, you definitely notice one side versus the other feels different because of whatever your issues are. Now, if you signed up just for Chair Tai Chi, I don't know what to think about that. Oh, well. Let's get that calf pump going on. Yes, I like to talk. Y'all notice that? People on the screen are going, yeah, we noticed. Okay. Woo! Does this feel tight? Oh, my. Or does it feel like, oh, this feels good because I'm kind of getting it a little bit loose, a little bit less constricted? Maybe that's what I'm thinking. And then bring it in. Okay, so I talked about knee strengtheners, right? Well, before we get on to that, because I know that's y'all's favorite thing to do, or in the top 5 at least, we've got to do some ankle articulation. So think about this. So most of us maybe drive a car, maybe, right? And then you're using that right foot, you're putting it on the accelerator. Typically, we have the foot turned a little bit to the side when we do that. So we're building a habit in our body. And also when we put the foot on the brake pedal, it's usually at an angle. So we're building these body patterns into us, and that affects how our ability to walk. So with that, with the foot turning in, we need to work on rotations going out to kind of counterbalance that. So I just thought I'd put that little tidbit out there for you. So we're going to take our fingertips back behind our knee pits and maybe scoot your booty back a little bit because you got to lean back a little bit. So let me show this sideways. So, I lean back a little bit when I do the point and flex. You can also interlace instead the fingers on top of the shin and lean back. So again, yes, we just did point and flex with our heel resting on the floor, but this allows you to go just a little bit more in your range of motion or notice what's going on. There might be some foot snap, crackle, pops happening also. Now we're going to look at the foot, we're going to have it be still, and then we're going to draw the tiniest circle that we can to the outside of the room. So this is also fine motor skills. And then make it medium circle or shape, in my case, and then the biggest shape you can. You may notice your shin starting to get tired. And then pause, and let's go the other way. Tiny little circle, medium circle, and then the big circle. Ooh, this one likes to talk a lot, my foot. Snap, crackle, pops, and release. Other side. So again, decide, hands back behind the knee, on the shin, whatever you're going to do. Lean back and start that point and flex. Now, sometimes when I'm too vigorous in my point and flexes, I get a leg cramp. So I'm always like testing it out first. I'm like going slow first. And then maybe I'll speed it up a little bit, but then again, maybe not. This one feels pretty good on this side. That right side, though, ooh, a little spicy. All right, and then make everything still. Then we're going to look at your foot. Then you're going to do foot circles, turn to the outside of the room. Tiny ones first, if you can. And then medium. And then a little bit bigger. Ooh. Kind of feel that tendon moving around that bone around the ankle. And then pause. All right, now look at your foot again. We're going to turn it inward. Tiny, tiny, tiny. and then medium. Ooh, and a little bit bigger. Very good. Bring your feet on the floor, clap your hands, rub that heat, and let's rub our shins, our calves here. You're allowed to hinge forward here and get the sides, the insides, the underneath, the other underneath. All right, scoot back in your chair all the way back, because now it's the knee strengthener opportunity. Opportunity, oh yeah. So we're gonna flex a foot, and I'm gonna lift that leg off, toes towards you. You might be feeling this all up in the leg. It's not gonna stay here for long though, okay? And then hovering the foot off the floor, and then point the toes forward, and then release. Woo! Other side, flex that foot, lift up if you need to, toes towards you, and then lower, hover, and then point the toes. So we're strengthening the musculature here around the knees, so that's a good thing, and release. Now we're going to add the brain building element to it. So Tai Chi is all about brain boosting. So we're going to flex the heel, flex the opposite hand, like a stop sign. You lower it a little bit, very good. And then lower, hover, point your toe, point your fingers. Now we're going to do the weird thing where we do a straight arm basketball dribble. You might feel this in your abdominals. And we hold the pose. So I'm being sneaky here, okay? And release. Woo! Again, come out of the posture when you need to, want to, okay? Other side. Flex the heel, flex the hand. Ooh, hello, spice. Hopefully the spice is nice. Lower hover. Point the toe, point the fingers. And again, zip up your abdominals and then up and down basketball dribbles. Gotta laugh somehow, okay? Get the good drugs in my brain when I laugh, whether it's funny or not, and release it down. All right, last one. Yay. Flex the heel, flex both hands, double stops, and then lower. Woo. Point the fingers, point the toes, alternate up and downs with those back of basketball. Now, if you can, both at the same time. That feels weird. And lower. Other side, here we go. Flex the heel, both hands flexed. Woo. Then lower, hover, and point the toe, point the fingers up and down. Here we go. Challenge those abdominals, those back muscles a little bit. If you can, maybe both at the same time, maybe not. And release. Wow. Scoot forward, clap your hands. Get that heat going on there. And from here, lean a little forward. Get the back side of yourself, either with the back of the hand or the palm of the hand, whatever you can manage better. Bring a little heat to the behind, the kidneys. If you can get up that high, some folks can't bring their hands behind them. They go to the hips. That works too. Get the hips, get the side of the legs, down the sides, down the shins. Bring it up the calves, bring it up the insides. Very good. From here, stomp those feet. Come up on the balls of the feet and shake the legs. And again, stomp the feet. Maybe you do some arms too. And shake the legs. Very good. Inhale, circle, sweep arms up. Bring down fists. Let's inhale, fist to chest. Exhale, sky high, reach. Inhale, back to your chest, open up the palm. Exhaling, pushing forward. Inhaling, back to your chest. Exhale out to the side. We're going to open and close 5 times. So here we go. 5, 4, 3, 2, and 1. Bring it back to your waistline. Inhale, fist to chest. This is for increased mobility. Exhale, sky high. Reach, reach, reach. Inhale, back to your chest. Open up the palm. Exhale, push it forward. Inhaling back to the chest. And then from here, turn sideways with your head and then reach out and then open and close 5 times. Here we go. 5, 4, 3, 2, and 1. Bring it back to your waistline. Other side, inhale, fist to chest. Last time. Exhale, sky high. Inhaling back to your chest, open up. Exhale, push forward. Inhaling back to your chest. Exhale out to the side, open and close. 5, 4, 3, 2, and 1. Last time. Here we go. Inhale, fist to chest. Exhale, sky high. Inhaling back to your chest, open up your palms or palm. Exhale, push it forward. Inhaling back to your chest. Turn that head. Exhale out to the side. Here we go. 5, 4, 3, 2, and 1. Bring it back to your waistline. And again, let's do finishing breath. Inhale, circle, sweep arms up, and bring down the chi. From here, we're going to do Kuan Yin paints the rainbow. So I have my palm facing my leg. And I'm going to take my palm, turn it away to where the thumb is in the back of the room, the pinky towards me. Now, you can turn your hand one way or the other. So, try this and then turn it the other way. Notice which one feels better to you. So with the elbow pit facing out, to me, that doesn't feel comfortable. The elbow facing away does. So just notice what feels okay for you. Then we're going to continue. We're going to inhale up. Exhale back behind you. You may have to turn your chest a little bit. And then inhale, gather both arms up, flip it. Bring the other one down. Now turn the palm away, pinky towards me, thumb to the back of the room. Here we go. Breathe in. Exhale back behind you. Notice which one is easier to do. Inhaling up, flip it, switch it. Bring the other hand down. Turn the thumb to the back of the room, pinky towards me. Here we go. Breathe in. Exhale back behind you. So this is for isolation of that shoulder range of motion. Inhale up, flip it, bring the other one down. This is the last time. Turn the palm away. Here we go. Breathe in, up, up, up. Exhale back behind you. Inhaling up and float it down. Let's do that finishing breath. Inhale, circle, sweep arms up. From here, bring it to the middle dantian, which is here at your heart center, and cup those hands once again. Kind of like when we kind of threw the arms, we're cupping the hands here. It's called spinal cord breathing. It allows us to do that pelvic tilt, that cat-cow yoga movement. So what we'll do here is inhale, elbows up, chest forward. Here's your cow pose. And then exhale, curve your spine to the back of the room. I guess you need to be away from the back of the chair to do that. And again, inhale, elbows up. Big old breath right there. Exhale, curve your spine. Let's turn to the side this time, opening up that rib musculature. Inhale up. Exhale back to the center. Nice and slow, nice and slow. Here we go. Other side. Inhaling up, up, up. Exhale back to the center. Let's do one more back into the center. So inhale, elbows up in the center. Exhale back here. Let's do the finishing breath. Inhale, circle, sweep arms up. Bring down the chi. All right, so in Yang style short form 12, we go through 12 postures on the right-hand side, 12 postures on the left-hand side. They're part of the 108 long form in traditional Tai Chi practices. But this first section in the long form, which is 30 postures, there's a posture where we take the fingers and hook them into your thumb. So it looks like a little goose head. You also, if you're already familiar with martial arts, you'll know this as like the striking position. So again, the kind of the back of the wrist is where you will be striking. We won't be striking in this next pose, but I wanted to give you that little bit kind of backstory of where we're going with this. It's called Young Man Praise. The first posture will be doing those goose fingers, as I like to call them, or strike hands. And they'll be up into a letter V. So, you kind of figure out, okay, you're really stretching the top of the wrist there. So it's stretching, it's addressing certain meridians in our body. So we'll get to that in just a second. So we bring the hands down here beside our hips. We go ahead and do the goose fingers, okay? We get ready for it. So this is kind of like a vigorous thing, kind of. Yeah. So basically, we're going to inhale and bring the hands up to that letter V, but we're going to do it with speed, if we can. So here we go. Inhale up. Oh, come back on down. We're going to do it again. So now you know what to expect, okay? So here we go. Inhaling up. Very good. Exhale, flat wrists out. Inhaling, bringing the hands towards one another. So you're kind of showing me your palms there. Okay, very good. And then you do a circle with the hands. So you're going to touch the side of the pinkies together. And you bring the hands towards you, do your hands together, and then fingers up, fingers towards your chest, fingers up, point it back away from you, bring it out in that little circle movement and float it back down. So those are the movements in Young Man Prays, kind of like the beginner part of it. Let's do that again a little bit. Okay, again, get those little goose fingers ready. And you know what to expect now. So here we go. We're going to inhale up. Exhale, flat wrists away. Inhaling, turn those hands, bring them towards one another. Once they get there, then scoop them like a little circle here. Side of the pinkies together, bring it towards you, palms together, fingers up, fingers towards your chest. Now your hands may be apart depending on your flexibility, okay? And then fingers back on up, fingers point away, forward, out, and down. Let's do that again. Then we're gonna add on. Ooh. So get your goose fingers ready, all right? Inhaling up. Exhale, push it away. Inhaling, draw it towards one another. And then do that little circle thing, pinky sides, palms together, fingers up, fingers towards your chest, fingers up. Push it forward, out, and down. Okay, here's the option that we add on. It's an option, not a requirement. You would lift a foot off the ground or be on your tippy toe on the floor. So you're really getting into that hip flexor, okay? So you're going to notice this probably. We'll see, yeah? So again, get your goose fingers ready. Kind of wiggle those shoulders a little bit, get that all nice and relaxed. So here we go. Inhale up, leg up. Keep the leg up. Exhale. Bring the hands together. Keep breathing. And do that little circle. Palms together towards you, fingers up, fingers towards your chest, fingers up, pointed away, out and down. Yay. Other side. Fingers up and knee up. Exhale away. Here we go. Bring them towards you, those hands. And then do that circle. Side of the hands, palms together towards you, fingers up, fingers towards the chest, fingers up, pointed away, out and down. Woo! That's it. Inhale, circle, sweep arms up. Bring down the chi. All right, so we're going to do a little brain challenge next. It's called Monk Carries the Flag. So we're going to take one hand, kind of wave to the side there, and take that hand across and low. So you're kind of like cupping your hand on the bottom of a flagpole. The other hand goes up. So here's your little flagpole on the side of the body. And then you take your opposite knee, lift it up, and stomp. Okay, you got that, okay? Now here's the challenge. You're going to take the low hand, make it be high, and make the other hand be low on the other side of the body. And then lift your knee up, and very good. Now we're going to add a little bit more to it. We're going to plunk down that flag, plunk, and lift that knee up and stomp. Plunk it on the other side. Here we go. Plunk it down, knee up and stomp. Plunk it down on the other side, and then knee up and the other side. Plunk it down, knee up. Now, we're going to add on just one time. We're going to try to extend the leg out. Might not happen. Just know that, okay? So here we go. Low hand, upper hand, knee up, extend the leg, knee up and down. Very good. Other side, get your flagpole nicely planted. Knee up, leg out, knee up and down. That's it for now, okay? Inhaling up, bring down that chi. Now, we kind of work those hip flexors, the muscles around the hip bones. We're going to do a little bit more. It's called slide. We did this in our chair yoga class, but we also do this in Chair Tai Chi. You may want to take the fingers underneath to help guide it. Now imagine there's a soccer ball here, and when you hop the leg over the soccer ball, maybe you can do this with your own muscular strength. Maybe you need a little assistance. Now I use my hands to go make it deeper in my range of motion. I kind of go beyond what I can do. Now, if you want to add a little bone building element to it, you would let the foot drop. Now, it's, of course, if you don't have brittle bones, right? Or maybe some stark osteoporosis numbers, you can just let it land softly or let it drop. Let's do two more. This is two. This is one, and then you bring it back. Okay, now the other side. We're going to bring it out and in. Again, this is the movement you do when you get in and out of the car. So if you do have back pain and it's kind of like aggravating you, you probably notice this when you're getting in and out of the car or having to drive and sitting in that little bucket seat, you know? Maybe. All right, add some air. There's a soccer ball, there's a golf ball, there's something there. You got to bring that leg up and over. Maybe it's your own muscular strength. Maybe you want to go past your own range of motion, guide it with your hand. And then maybe you let it drop for that bone building benefit. Ooh, BBB, bone building benefit. Ooh. Does this one feel different than the other one? It might. Let's do two more. Here's two. Here's one. We're going to go back on out because I don't know how to count. And there you go. All right, so there's another one that we can do adding on to sumo stomp. We can do sumo ruckus. Now, it's going to be weird. I'm just going to tell you that. Basically, when you bring your knee up and out to the side, you raise your fists up and place them down. And when you bring them back up and back to the center. But that's not all. Then you have to also vocalize if you want to. So here we go. Hi-ya. Hi-ya. Again. Hi-ya. Hi-ya. Two more. Hi-ya. Hi-ya. Last one. Hi-ya. This side. Hi-ya. Woo. Okay, you got it. Other side. Here we go. Hi-ya. 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 Two more. Hi-ya. Hi-ya. One more. Hi-ya. Hi-ya. Woo. Inhale, circle, sweep arms up. Bring down that chi. Let's do that breath two more times. Inhaling up, 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 up. And exhale. One more time. Breathe in. And down. Beautiful. All right. Sit up nice and tall here. Let's take a hand out to the side and then inhale, bring it across. Exhale out to the side. Inhaling up and over. And then exhale. Land it out here in front. Bring it back in. Other side. Inhaling, bring it across. Exhale out to the side. Inhale up and over. And exhale. This is called swallow flies to the nest. So let's add the poem to it. Swallow flies east, breathe in. Swallow flies west, exhale. Swallow flies up and over and lands in its nest. Other side, swallow flies east, bring it across. Swallow flies west. Swallow flies up and over and lands in its nest. One more time. Breathe in, bring it across. Exhaling. Inhaling up and over. And exhale. One more time. Breathe in, bring it across. Exhaling. Inhaling up and over. And exhale. From here, inhale, circle, sweep arms up. Bring down the chi. From here, let's do parry. So draw a circle in and draw another circle in. So I'm shifting my weight from one bone to the other, one sits bone to the other, one behind to the other. Maybe my feet a little wide. I was thinking about this the other day. What has two circles that we kind of know about? And I was thinking, oh, a DJ with his turntables. So maybe we're scratching. Well, maybe we're not. I don't know. Also think about pancakes when we're doing parry. I don't know why, because they're round. All right, and then we're going to pause, and then we're going to wipe it out. So this is when I'm thinking about my coffee table, going out to the corners of my coffee table with that rag with a little spray on it, yeah? So reaching out, getting into those hips, getting into the side body musculature, getting into, of course, the shoulders, the upper back, the mid back with this movement. Now bring it to where you're doing the windows. Here we go. Y'all know this. Wax on, wax off. Again, it might be smaller than what I'm doing, and that's okay. Do what you can with what you got today. And then we're going to pause and then think about wiping it in. Takes a couple times to kind of get in that groove, yeah? If you want to do more vigor for getting into your lungs, make fists, bring the elbows a little bit more cross. And lubricating that spine with this movement too. You may be noticing that, yeah? All right, let's bring this back on top. We're wiping it in. And then make it smaller, smaller, and smaller. Bring the hands. Notice if they're feeling any sensation, they might be. We're going to do what's called the Tai Chi ball. We're going to bring our hands to our collarbones and lift the elbows up a little bit, but don't have them like way up high. Have them low a little bit and bring the hands forward. From here, inhaling, open up. Exhale, bring it in. Now what we're going to try to do is add a little eye exercise to this. So as you're bringing your hands outward, look side to side. Don't move your head though, so you can check where your peripheral vision is, okay? So here we go. Breathe in, look side to side with your eyes until you can't see the hands anymore, and then bring them in. You can do this slowly. Let's do that again. Inhaling, look from fingertip to fingertip. Get a little eye exercise there, bring it in. Very nice. Clap the hands. Get some heat going on there. And I'm going to come up a little bit to the front of the room. We're going to do a little bit more energy work here in our Chair Tai Chi class. Yep, I got a squeaky chair. And from here, again, clap the hands. Get that heat going on. I don't know if we've done this lately, but we're going to do that today. I'm going to sit away from the back of the chair. So let me scooch forward a little bit. And I was getting really relaxed there. We're going to take one hand on top of the thigh. And we have the wrist kind of coming off the side. This is called the water pump. You take the other hand on top of the fingers and you lift that wrist up and down. So again, for lymphatic flow. And you might feel knuckles snap, crackle, popping here also. We like to do some of these hand movements in our Chair Tai Chi class. Very good. All right, now take the other hand, again, curve it off the side of your leg, hand on top of the fingers, get it nice and firm. Now the thumb is freestyle, okay? And lift up and down. Ooh, I felt a little snap, crackle, pop on that one. Very good. Okay, next, my hand is on my leg, and I'm going to take the pad of my index finger and put it underneath the first knuckle of my finger. So I'm stretching the base of my finger. So I'm going to lift up. Again, I'm not trying to go towards pain. Got trigger fingers, that kind of thing. Maybe some osteoarthritis. Osteo meaning bone, arth meaning joint, itis meaning inflammation. It's kind of funny how that kind of works out for the word. And then release it down. Let's go to the index finger. Ooh. My index finger doesn't stretch up as much as my middle finger doesn't stretch up as much as my index finger. All right, let's go to the ring finger. Lift it up. Again, do what you can. Don't go to the ouch zone. And release it down. Let's do the pinky. Here we go. I think my pinky has a mind of its own. It does its own thing, like the thumb does. Yeah. I think it's because it has its own set of ligaments and that kind of thing. All right, now let's do the thumb. Mine doesn't lift up very much, but I still feel that stretch kind of at the base of the thumb a little bit. Now, one of the things I like to do, let's release from that, is go from thumb base to thumb base to rub the thumb bases. Again, you can be as slow as you need to here. The amount of pressure is up to you. I just feel that really helps a lot. All right, let's do the other one. Again, we're going to do the index finger first. There at that first joint, lift it up. Woo. And then lower. Let's do the other one. So the belly breathing, I was talking about that earlier. So what does that do for your brain? It uses your diaphragm, which activates your vagus nerve. which is the nerve in your body that triggers your body's relaxation response, for your parasympathetic nervous system. So your release and relax, and lowers the body's stress response for the sympathetic nerves, which is that fight or flight. So, expanding the belly out as you breathe in and then towards your belly button. That's a good thing. Let's do the ring finger. Ooh, that one feels stiff. So there's also additional studies that have found that lower belly breathing helps with cerebral spinal fluid flow, which is getting rid of the waste that's in the brain nightly. So if you have a challenge sleeping at night, which a lot of veterans do, a lot of folks do, you don't get that good REM sleep. So that's usually when you get your cerebral spinal fluid flow. Let's go to the pinky to get rid of your brain cellular waste. So by doing the lower belly breathing in our practices that we do, that helps facilitate less dementia, getting rid of that brain waste. So again, it's linked to lessening dementia, and those with higher cerebral spinal fluid rates have less dementia and release. Let's do the thumb. I went up to Mayo back in September and I had a brain scan. So I'm one of the people that were selected for the breathing practice to notice about my cerebral spinal fluid flow. That's so hard to say. And because I've been training in this for, I think it's 3 years now. And so my flow rates were very similar to the leader of the clinical study. So I was like, wow, okay. And he's been doing the breathing practice for 25 years. And release. Let's go ahead and kind of clap those hands and again, get some heat here into the palms, into the fingers. And we might as well do the hand tapping technique. So we're going to do the side of the hand. So that's for headaches and vertigo. So again, you're not whapping, it's just the tapping. And we do like a little sampler in class. So typically you would do this for about a minute at each place. That's hard to say. Then we're going to do the interwebs of the thumb. So that's for aiding digestion. It's for nausea. So again, you're tapping into that web. And kind of let your fingers be relaxed when you do that. Don't do it with stiff hands, okay? Although I guess you could do it with stiff hands. And then we're going to switch it and do some more. My watch is making a little noise there. So the interwebs of the fingers is for pain or numbness in the limb. So you kind of interlace. So you normally interlace your fingers a certain way. So interlace them. And again, let's tap into those little valleys. Notice what you notice, because some of us have some, arthritis going on in the different joints here in our hands and our fingers. Yeah. Now wiggle the top finger, and then you're going to switch the other finger to be on top. That might make your brain go, what? Again, you were doing things that are kind of not normal to you, interlacing your hands a different way. They say you can activate different neural pathways by using your other hand to brush your teeth. That's maybe crazy. Move your mouse over to the other side. Oh, that'll really mess you up, right? Okay, so let's go to the pulse points next. Now, some folks place it down on their leg and they tap, but I find I tap too hard when I do that, so I bring it into the air. So that's for heart and cardiovascular issues. So tap, tap, tap. And again, I'm going to let my fingers relax a little bit. That's kind of hard to do. Let those fingers relax, that is. And then flip it, here we go, into those pulse points. All right, so the next one is with the cupped hand. Once again, if you've got rings, you're going to curve it a little bit. We're tapping the back of the hand. That's for osteoarthritis, for back pain. Makes a nice little kind of cuppy sound. Again, I'm not whapping. It's a gentle tap. I'm going to move my bracelets down. We're going to go to the back of the wrist. Let's see what that's for. neck and shoulder pain. I have a list here to the side because I can never remember when I'm teaching, of course. I can tell you when I'm not teaching what these are. So I use my list to make sure I'm saying the correct things. Okay, now back of the other hand. So again, cup the hand. Here we go. I know I have a nurse that's in my class earlier, and she goes, "Yeah, this is great because it makes the veins pop out. So when I need to put an IV in." I went, "Good to know." All right, let's do the back of the wrist. Here we go. I'm kind of tapping my watch here. Let me move it up here. All right, so the next one is making a fist and punching into the palm to lessen that stress and anxiety. So here we go. I'm a little more vigorous on this one. Let's do the other side. So you'll notice strength one side versus the other. Now we're going to do the tapping sequence to help lessen insomnia. One of the things you do, sometimes we do the big six for our Qigong detox. We didn't do that today. We did other things. But one of the things, we slap the armpit. So you pick which one. I usually do the left one because that's near the heart. So basically you're rubbing, scrubbing into the armpit. You only have to do one, though, for the lessening insomnia sequence. You can tap. You can pat. Again, this is good for, getting lymphatic flow going on. Okay, and then the next thing is, now this is a little spicy. Yeah, tapping the arm elbow pits. So you don't go as strong as you were doing the back of the hand because it's spicy. It can be. Ooh, okay, I was too strong. Okay, now I'm going to scoot back a little bit on this next one. I'm taking off my glasses because this next one is pulling on the earlobes. So the ears represent, kind of like in reflexology, your hands and your feet do. Your body is represented also on your ears. So move my hair out of the way, take my fingers, make sure they're dry, pull down on my earlobes, pull, pull, pull. You might notice your hearing feels like maybe more clear, maybe. And then pull outward as if you're trying to pull your ears off your head. And then pull up. Ooh, very good. We do this 2 more times. It's a sequence of 3. So again, pull down on the earlobes. You might notice your ears starting to get a little warm. That's a good thing. And then pull out. My ears are getting sweaty. How is that possible? And then pull up, 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 up. Ooh. One more time. Bear with me. Wipe off the sweat off my hands. Okay, and pull down. Pull those ears outward and pull upward. All right. Since we're here and the glasses are off, maybe rub into those palms. Let's do kind of the eye soother technique. So get some heat. Get some heat going on here. We're going to take the heel of the hand, place it on the cheekbone, and cover the eye. So you're also stimulating the sinuses to open up. So press on the cheekbone, hand covering the eyes. If you can, open the eyes and then close them. And then take the outside of your heel of your hand, press near your nose and press away to open up the sinuses just a little bit. Now we're going to take the heel of the hand, press into the inside of the eyebrows, and then pull the eyebrows apart. Then take the pads of your fingers. If you've got fingernails, be careful here. Tap the eyebrows from the inside to the outside. I recommend the eyes closed while you do that. And to further stimulate the brain, all the meridians go through various places in the head. Move your tapping from the kind of the top of the forehead, and then tap it back, kind of like a mohawk. And then start kind of going out a little bit, so making it wider. And then go to the side and to the back, to the side. And then if you want to, this is totally optional, get the finger pads and just vigorously scrub your scalp, okay? Again, we're addressing all the meridians. They all come through the head. Get the sides also, because we have some meridians that go through the sides that don't go through the top. It's going to be a bad hair day, let me just tell you. That's okay. Very good. Clap the hands. A little bit of heat. Now you can place your hands together, stacked at your heart, resting on your lap, whatever's comfortable. And we're going to do that healing sun meditation. So wriggle those shoulders just a little bit and relax it down. Very good. Eyes can gaze forward, can gaze down at the floor, or you can softly close them. You get to pick, okay? I'm going to look down at the floor. So while we're here, notice your feet firm onto the floor. Notice the buttocks, the low back, maybe a bit of the upper back pressed into the chair, back of the legs. So notice your sensation of support here. And then at Governor's Vessel number 20, that's where a lot of the meridians intersect. It's a very special place in our body. It's the crown of the head. So imagine the crown of the head opening up just a little bit. And then that healing ray of sunshine coming down through that little opening in the top of the skull. And it's going all the way down the head, through the neck, the shoulders, the back, the chest, the upper arms, lower arms, fingers, through the belly to the hips, through the legs, the knees, the ankles, the feet, all the way from the top, all the way down to the tips of the toes. Imagine that healing light coming in, permeating every cell of the body, saturating that healing sunshine. Bring in the light, bring in the healing. See it, feel it. Every bone, every tendon, every layer of the skin. If you have a spicy area today, maybe you can direct that sunshine, that healing light to that area. Just let it saturate it. Imagine as if you were already healed. Imagine as if it were already true. So that's called a mind intent. Oftentimes, if you say it, it's happening. If you feel it, it's happening. So negative talk usually means negative feelings. Positive talk, maybe positive feelings. I know that's kind of out there, but take it for what it's worth, okay? And then we'll do that elongated breath just for one more practice of the breath. What I will do is I'll clap my hands 4 times as we breathe in. We'll pause, and then we'll slowly breathe out for a count of 4. If you can, think about also expanding the belly as you breathe in, and then really super contracting it as we exhale. Let's just practice this together for about 3 to 4 times. So here we go. Breathe in. Pausing, slowly exhale. Now again, breathe in, belly big. And exhale. One more time. Here we go. Breathe in, belly big. And exhaling. Good. Let's come away from the back of the chair, come back to kind of the front of the chair. Let's do swimming dragon one more time, just to kind of notice what we notice here. So hands together, breathe in, belly big. And then exhale, push hands away, turn the head. Notice if it feels a little bit more open, more ease, maybe not. And then bring it back to the center. And let's do that again. Breathe in, belly big. Exhale, push it away, other side. Very good. Bring it back to the center. Let's do spread the feathers. So open up the hands, hands out to the side, lower the arm, turn the hand to the back of the room, and then really turn it, okay? And then take that opposite ear, drop it towards the shoulder. Now take that chin, look towards the shoulder. Taking the chin, look where the wall meets the ceiling. And draw that half circle with the chin. Bring it down towards your chest, towards that extended arm side. and release. Maybe different, maybe not. Again, other side, spread the feathers, bring it out to the side, turn that thumb to the back of the room, activate the meridians, the muscles on that extended arm. From here, take the opposite ear, drop it towards the shoulder. More blood flow to the brain. I love it. Now take the chin, look where the shoulder is. Ooh. Notice if there's spice, okay? Let's lift the chin where the wall meets the ceiling. And then think about that half circle that you're going to draw with your chin. Bring it down towards your chest and then towards that extended arm side, and then bring it back to the center. Beautiful. All right, we're going to end our class now. So we're going to take that right fist, that's the sun, and that flat left palm, that's the moon. And then we bow down to one another to honor one another in our Chair Tai Chi class today.